I'd like to introduce our moderator for this discussion, Adamu from the World Health Organization Regional Office for Africa. Abdu is also the chair of the HCE Coalition MERLA Task Team. Thank you, Abdu, for your support. I'll turn it over to you for a discussion with the panelists, and I'll also encourage folks to add any questions you are having as you've seen the videos and the presentations, and as you're listening to the panelist discussion, add those to the Q&A box or the chat.
So let me start with our colleagues from Ethiopia. The question I would like to ask is what has been the most effective method for engaging diverse stakeholders, because CAS involves stakeholders from Ministry of Health, from donor agencies, for implementation partners. And we just want to hear from you some of those methods that we've used to engage the stakeholders. Yes, so the question is, I just asked, let the audience learn from you some of those effective methods that you have been using for engaging stakeholders in your CAS journey.
Thank you very much. So initially, in the office, we discussed with the state minister the importance of this CAS, and we all agreed in one sound. It is very important. We addressed this initiative to our donors through a letter from the state minister. So he sent the letter and he called a meeting. So in the first meeting with the stakeholders, he addressed that question and the initiative. So most of them agreed, and we wanted to socialize and discuss on this issue. So on that socialization, the Ethiopian government cover all the costs and call all stakeholders into a hotel, including donors and implementing partners, including the region ones. So everyone was happy because this undertaking was so important for each of them, and they are also happy that it is honored by the Ministry of Health. So that is the main reason everyone is part of it. So every time we call a meeting, either it is a steering committee or technical working group, almost all partners are part of the meeting. So if you can see my slides in all stakeholders meeting, you can see the pictures, and some of the team came from US and Nigeria. You have seen the participation of all participants. So that is, the main reason is it is owned by the senior officials, especially it's part of the government system. If I answer you, it's okay. Otherwise, we can receive further question. Over to you.
Thank you so much, Lelisa. So let me turn to our colleagues from Nigeria, Zaya and Shehu. Let's also hear from you. We know that Nigeria also has a complex health system, and we just want to learn from you some of those things that you've done, those effective methods or methods that you consider useful for stakeholder engagement. So maybe let's start with Shehu, then Zaya can add.
Okay, yeah, thank you, Dr. Abdul. I will follow the route of my colleague from Ethiopia. Immediately after the first meeting that we had in Ethiopia, on our return back to Nigeria, we debriefed the two leadership, that the Federal Minister of Health and also the ED, MP, CDA. And if you look at the presentation made by Zaya, Nigeria as a country, in fact, the Federal Minister of Health is talking about swap, and also the ED, also in his own comment, we listened to him very well, talking about our own strategic blueprints, which align with the CAS recommendation. So, after the briefing of the brief of the two leadership, we map all the partners, donor, and also even the government in campaign ecosystem in the country. And we had our first inaugural meeting where we also presented the CAS recommendation to them. During this meeting, The partners donor are divided into groups and under the P&I, Mala and financing. And that's how we form the TWG subgroup that come up with the time of reference. And after that, we've had a lot of meeting. TWG meeting every other week, where we also look at the CAS activities. At the same time, we have also had at least one or two co-creation meeting or workshop, where we allow all the partners also to come up with their own input and see how the CAS recommendation can be implemented in Nigeria after we have customized into Nigeria content. So in Nigeria, all the stakeholders, the partner donors are also singing integration, which is part of the CAS recommendation. So I think we are all in alignment now, and I believe we are going to have a very successful CAS implementation in Nigeria. Thank you, Anuga.
All right, thank you very much, and it's so delightful to hear some of these things that you've done in country, especially customizing these engagement models to country context in the previous year. And I am actually so glad to hear that most of what we've discussed so far are some of those key things that helped us in the previous year. So I just want to hear from you now some of the things that you consider, or what success would look like for you, like that a success with implementing CAS would look like for you in this current year, 2025. So let's continue with you, Shehu, before I go to Lelisa.
Yes, thank you again, Dr. Adamu. As I've said, we have gone a long way in this CAS implementation. I also repeat again, in my own presentation, I mentioned that first of all, the CAS recommendation is in MPCD strategic blueprint and also in SWAP to ensure, talking about streamlining of campaign to be more to have a better outcome. So like this year, apart from that, we are also able to identify both the federal ministry and MPCD priorities. All these are also inclusive in the NCAS, which we customize. And recently, just like what I said and my ED said, we had a solution meeting where we also invited all the partners donor. Although this was focused on polio and non-polio, but at the end of the day, our focus is to see how we can also bring about other intervention from federal ministry of health. So I think for the success, for the alignment with the partners and donor, everybody talking about CAS now, and also the commitment we have from the both co-chair, that is the ED, MPCD, and also the Director of Public Health from the Federal Ministry of Health. I think for Nigeria as a country, we are good to go, because already, as I've said, planning, like for now, we have already started planning with the polio and non-polio. As I said, we have the MR campaign this year, and already we are already coordinating on how to see how we can, integrate right from the planning stage. So we have been meeting, and also, as I've said, our focus is also at the end of the day to see what we can also bring in from the Federal Ministry of Health. So I think for this year, I'm very hopeful that we are going to start the CAS implementation. Thank you.
All right. Yes, just a little bit follow up there. You're talking in your presentation, and just right now you made reference to how you're integrating the planning now for the MR campaign and even the polio campaigns and so on and so forth. And during your presentation, you mentioned having a calendar for 2025 for all of the campaigns. Now, my question is, in this shrinking donor space, how do you think partners can work differently to enhance campaign effectiveness?
Well, thank you very much, Dr. Adamu. As I've said, I think we have been able to, first of all, to gain the mind of the partners. I mean, in alignment. Because if you look at the SWAP in Nigeria, it's talking about one plan, one country, one budget, and one compensation. Meaning that we need to see how we can look at our budget from various partners. Now that you said the US already are trying to withdrawing some of the money that they support some of these activities. So it's just for us to see that we, for the little resources we have, we align and we harmonize the budget so that there won't be duplication. So I think I think with that we'll be able to achieve a lot before and also again you have to do when when you have some money going that you cannot access again, you also have to identify resource mobilization. So you look at how you can also reach out to other donors that will come in to, to bridge the gap. So I think the major focus on how we can do this about the process as far as funding is harmonization of projects. What we have to support intervention to avoid duplication. Thank you.
All right, thank you so much, Shil. So I'll go over to back to you, Lelisa. Lelisa, are you still with us?
Yes, yes, I'm here.
Oh, great, great. Yes. So in 2025, based on your experience so far in 2025, what does success looks like for you in terms of CAS?
Yes, if we see, I'm sorry for not displaying my slide earlier. If we see our early result in
Mhm.
February 2025, we already start integrating campaigns. We had a polio campaign, which
Mm,
was conducted over 14 million child for polio. So we included zero dose and also we included club foot identification.
mm,
So, zero dose, everyone knows that children didn't get access. So when we go for polio house to house, we identified 61,000 child with zero dose, and we vaccinated 61,000 with the polio campaign. Also, we included clubfoot children, and we brought them to treatment or to health facilities. So we also started a big catch-up campaigns, and in that big catch-up campaign, catch-up vaccination, we included malaria fever test, insecticide treated net distribution for children, also vitamin A supplementation,
mm,
and people living PLW screening. So we also included fistula in this one, and this has been implemented. We
mm,
also doing the in the polio campaign, so zero dose is included, and now we will have a big measles campaign in front of us, so that will be included. So we consider success for 2025 is so doing the CAS rollout at the regional level. And when we roll out CAS to the regional level, almost we can include vaccination, all vaccination, and other campaigns. At least we can co-deliver if we don't 100%.
mm. So, wow, that's really, really exciting. And might you just share with us some of the things that you're going to do or put in place to improve the efficiency of these campaigns, or probably your expectations, rather?
Sorry, in between it is disconnected, Abdul.
Okay, sorry. Yes, so I was saying that's a lot of campaigns, and you've hit 2025 on a very good footing with so many activities going on at the moment in country. And you spoke about integrating also at regional level. So I asked, what are some of those things that you are going to put in place to improve efficiency of these campaigns, of these yes, of these campaigns?
Yeah, to improve the efficiency of the campaigns, I think first we need to start roll out at the regional level. So And also, we have to finalize our implementation guideline. Once we finalize the implementation guideline, that will be our that will be our Bible or
Mm. Lelisa, you're breaking.
hello.
Hello, Lelisa. Can you hear me?
Yes, I can hear you. Can you hear me?
Oh, okay. Yes, yes. We lost you for a couple of seconds there.
Oh, yeah,
Yes,
I'm
please.
sorry. So what our strategy is rolling out CAS to the regional level. So
Mhm.
also we need to improve the implementation. We have to finalize our implementation guideline, which will be the guide for all the country. And from our experience, when we do CAS micro planning, so everyone from regions will be part of it. If we all sit and plan together on the micro planning, so the effectiveness will be higher. So it will get more attention as everyone knows about it. So yeah, that will increase the quality.
All right. And yes, so in terms of, I'd just like to ask you a follow-on question. With all of these
Please.
campaigns going on in country, can you just tell us a little bit about the kind of things that you would want to see changed in terms of financing for these campaigns?
Yes, financing is a challenge, even if without, even before the US budget cut, the US government budget cut. But yeah, sometimes as a government, we have to take some major initiative. So actually, when the budget reduced, bringing campaigns together will be an advantage rather than going piece by piece. So yeah, we are still under discussion on how to cover some of the budget reduction, some of the budget cuts. And as a country, we have also discussed with our prime minister. He requested us to bring some major initiative which that needs priority so that he can intervene. So that way we will do that. But it does not mean that we don't need budget or money or it won't affect our activity. Yeah, it does, but we will do our best and we are working on it, including the minister and the state ministers.
All right, thank you so much, Lelisa. We're rounding up this panel of discussion now, and I have just one more questions for each of you, which just in 30 seconds, please, just give us an answer. So I just want to hear from you, what is the main challenge that you anticipate for 2025, and how do you plan to address that challenge? In just 30 seconds, please. We're already out of time. Yes, I'll start with you, Lelisa, and then I'll go to Shehu.
Yeah, the main challenge will be the budget. But the budget, we will look for international support, but we have to also look into our treasury or to the internal discussion. So that is what we have planned, and the details we can share because we are working on some compact activities. So trying to bring, even not in the campaigns, but in other like family planning, we are preparing a compact document so that that will be supported by either the government or anyone to step in. So we are preparing some compact documents. We will also do that for we started working that for NTD, for maternal child health activities, and we will also include in that compact document this CAS or this activity
All right,
over
thank you
time.
so much. Yes, thank you. And Shehu, 1 minute, please.
Yeah, thank you, Dr. Damu. I think for us also in Nigeria, there are two, the commodity for the intervention and also the funding, the funding. Because for all the intervention, they are getting their commodity or funding from different partners. So are they going to be readily available at at the same time? Like for the MR campaign and that we plan for October, already we have this decision letter for vaccine, and also we have Gavi decision letter signed. That is what we have the funding. For if we want to include another intervention, are they going to have the commodity at the same time? So to avoid this is a kind of early planning with what you want to integrate, and also what you want to co-deliver, and also maybe looking inward or outside the box, how you can also mobilize resources in case of any emergency that you want to bring it
Thank you.
up. Thank you.
Thank you so much. And sorry, Zaya, for not being able to join this discussion for your internet challenges. And thank you so much to the panelists for this insightful discussion. I will now hand over to Alison to complete the Q&A session. Over to you, Alison.